My name is Dr. Kasra Haghighat. My patients call me Dr. H. I have done 10 years of family practice, walk-in and urgent care. And the past 5 years, I have specialized in chronic pain management through interventional means and been working at York Medical Chronic Pain Clinic, providing interventional pain management, including nerve blocks, joint injection, and trigger points. We treat a variety of pain conditions, including chronic neck pain, back pain, shoulder pain, and chronic headaches, as well as fibromyalgia. We use a multidisciplinary approach, including injections, medications, psychotherapy, mindfulness, and rehab and physiotherapy. In today's video, we're just going to do some general talks about your body, your health, and in the future videos, we'll touch on many different topics in medicine and overall health, and we will also discuss pain management as well. I will respond to any of the comments that you leave, and I would appreciate them, and I will make future videos based on the topics that you guys request. I will try to do one video per week, and I apologize in advance as I'm new in this, using the video and YouTube posting. So as time goes by, I will try to improve the quality of the videos, audio-visual effects. So to start with, we're going to talk about prevention. Always prevention is more important than anything else. As it has been said in the past, an ounce of prevention is better than a pound of cure. And so that's very important. The means of doing prevention has to do with lifestyle, and that is something that we will talk about in all our videos. Medical diagnosis is basically an educated guess at best. So as doctors, we train hard. Often it takes 4 to 8 years to get into medical school. Then in medical school is another 4 years of intensive training. And after that is a minimum of 2 years, and often there is a much longer period of residency, fellowship, and extra training. And it's an ongoing learning process. I mean, even right now, after 15 years of being a doctor, I still have to read every day to keep up to date. And in the past year, I have done over 1,000 hour worth of lessons and continued medical education programs through online programs, attending conferences, or reading journals just to remain up to date. But yet, every case is different, and every patient is different. Every patient's response to medications and treatment is different, and often the presentation of the condition by each patient can be different. So we try to get as much information as possible, do the appropriate tests, and based on all the information available at the time, we try to make the best educated guess at our diagnosis, or what we call differential diagnosis. And as we get more information, then our diagnosis will be adjusted and changed. And I have to admit that even during residency, I have seen doctors, specialists that have been working for many years, and these guys are like super experts in their field. And there have been times that their first best educated guess had been incorrect. And sometimes that happens. So that's the reality. And treatments are not guaranteed. So not every medication works on everybody the same way, not every treatment works the same way, and there's no guarantee that it's going to work. Now, I know that sometimes they say, for instance, if you were to use cortisone, prednisone, they say that there's a 1 in 10,000, or in some cases 1 in 40,000 chance of avascular necrosis of the hip. And that's a horrible thing to happen, and it can happen at any age, but the chances are very slim and low. However, when it comes to that patient that actually gets it, that 1 in 40,000, it doesn't matter that the chance was 1 in 40,000, that patient got it and is in trouble. So it's important to know that nothing is 100% guaranteed, and again, comes back to prevention being the best. Every medication and therapy come with potential risk and side effects. And this, I'm sure everybody have experienced at some level, that there are some medications that in some people works like miracle drug and makes them better, they feel great, no side effect, and some people take that and they feel horrible, near death experience at some times with some reactions that they may have to some medications. So that's why often doctors start medications at low dose and gradually increase the dose, because some people can have horrible reaction and there's no way of us knowing. We of course ask if there has been any history of previous allergies, etc., to get some more information, but the reality is not every medication works the same on everybody. Errors and mistakes, of course unintended, are reality in medicine. So, and these are sometimes there have been in the news, you hear that medication was dispensed for antibiotic, but it had been mislabeled, and the pharmacy had dispensed strong blood pressure medication instead of the antibiotic, and the patient blood pressure had dropped and had caused severe consequences. And then there are sometimes that blood works get mixed up. I have had pregnancy test positive on a male patient, which makes no sense. I have had ultrasound done that showed ovarian cysts on a patient that had ovaries removed years ago. And of course, these things do happen, and patients and doctors, we are all trying to be aware of these things and try to minimize them. But at various levels, various mistakes can happen. So again, prevention is the best. Now, the important thing is about the nature. Nurture. So we cannot choose our parents or our genes. So a lot of times patients say, what's the point of watching my diet or lifestyle? My dad had diabetes, my mom has diabetes, my brothers have diabetes, my uncles, my aunts, everybody have diabetes, so I'm doomed to get diabetes. To some extent, this is true that genetics does play a major factor, but what it does is it increases the risk of getting it. So you would have a predisposition to it. Doesn't automatically mean that you are going to get diabetes. Okay, so lifestyle is an important factor in our health. For instance, I know a family that the mother, the father have diabetes, are significantly overweight. Two older brothers have diabetes, significantly overweight, and sedentary lifestyle with not much exercise and high stress. But the younger brother, skinny, been working out all the time, exercises, eats healthy, doesn't drink alcohol, doesn't smoke, and follows a healthy lifestyle, and he does not have diabetes, and the chances are he will likely never get diabetes if he maintains the appropriate lifestyle, even though he has a high predisposition. So if he goes in a carbohydrate rich diet, sedentary lifestyle, starts drinking a couple of beers a day and stuff, then of course he has the predisposition. He's at higher risk than a general population to get diabetes because of his strong family history, which probably is some genetic factors involved. But once again, that just means that patient has to be much more aware and work on prevention. Essentially, what we are saying is we have to focus on what we can control. We cannot control who our parents are or what our genes are, but we can control lifestyle or activities and do what we can. Healthy lifestyle essentially is the key to long, happy life. So it's not just living a long life or how long you live, but it's how healthy you live. So if somebody lives 90 years old or 100 years old, but the last 10, 15 years of their lives, they have severe COPD, they cannot breathe, they cannot go outside. They have severe knee pain and back pain, and they cannot move. And various different medical conditions, that 10, 20 years is not quality of life. So quality of life, again, through lifestyle, For instance, again, when it comes to knee arthritis, let's say again, we have a family, father, mother, two brothers and a sister, grandpa, everybody have severe arthritis. Everybody's severely obese and smokers. So both weight contributes to arthritis. For every pound extra, there's 4 times the force on the knee, and it's basically grinding the joint and wearing out the cartilage, just like a bicycle. Old bicycles, the brake wears off. That's what happens with the cartilage, bone on bone, and then they wear out, and that's where arthritis happens. So if somebody is overweight, more predisposed to get it. If somebody smokes, smoking reduces the blood flow to the cartilage and more predisposition to getting diabetes, to getting arthritis. Now, if person is genetically predisposed with a strong family history, but keeps a perfect weight, healthy weight for his height, and he exercises, in the future videos we talk about some exercises for the knee, to strengthen the upper thigh to take the pressure off the cartilage, so less likely for it to wear off, this person may never experience arthritis. So if he gets to live 90 years or 100 years, he's not going to be in wheelchair for the last 10, 15 years in pain because of knee pain, because through his lifestyle, he was able to make a difference. And again, healthy lifestyle is a key to long, happy life. Now, when it comes to annual checkups, it's very important to do your annual checkups. In some countries, some places, they may not have medical coverage. They may not afford to have an annual checkup. In Canada, we are lucky. We have a OHIP in Ontario, and depending on the province, called different things, but it's basically a free healthcare. And it's important to do an annual checkup. So annual checkup, often patients says, when I used to do family practice, my female patients often would come every year, but their husband would never come. And sometimes, the wives would drag them to come, and they would say, oh, in 10 years I haven't gone to a doctor, there's nothing wrong with me. And as you know, many studies have shown that married men live longer. And I think it's probably because they have their wives nagging them to go to the doctor, get their annual checkup, probably their wives encouraging them to follow a healthy lifestyle to some extent. So you always hear the stories of a 50-year-old or 60-year-old that was perfectly healthy, never went to a doctor, everything was perfect, and suddenly dropped dead. The reason is that there's many people out there with high blood pressure. It used to be 1/3 and now is about 1/4 that have high blood pressure, they don't know it. And high blood pressure is the #1 cause of stroke. It also contributes to heart attacks. So you can have high cholesterol, you can have high blood pressure, you could be a ticking time bomb without even knowing it. So if this 55-year-old that dropped dead, if this person had gone to the doctor, probably at the age of 40 or 45, he would have been diagnosed with borderline blood pressure. He would have been advised on proper lifestyle measures to rectify the issue, and sometimes medication might have been needed. And he would have been educated on unhealthy lifestyle, etc. And probably that could have saved his life. So that makes a huge difference. It's not that when you're sick to go to the doctor, that's one thing, but more important is to go when you're healthy to keep healthy. So when you buy a car, you have to take it for maintenance. You cannot say, oh, my car is fine, I don't need to bring it I don't need to do oil change, there's nothing wrong with it. But no, if you do not do your regular oil change, the car will break down. Same thing goes with your body. So you have to have a regular checkup. Tune-up, whatever you call it. Early diagnosis and risk reduction is the best. So again, things like colon cancer. Over the age of 50, it's important to do regular colon screening, now whether it's in the form of colonoscopy every 10 years or fecal occult blood test, which is a stool test that you do at home every 2 years. If we can diagnose it early on, it's fully curable. So at early stages of colon cancer, it's just like a little pimple in the colon, a little polyp. And if diagnosed, it is removed, and the person would be monitored every few years. And if any little one starts, they remove it, never becomes cancer. It takes between 8 to 10 years for this to turn into cancer, where then often it is incurable. Sometimes depending again on what stage it is. Sometimes by removing the colon and having a bag, colostomy bag and stuff, may help to some extent slow down the progression. But a lot of times when it's discovered is when it has already metastasized and caused strictures and symptoms. And by the time most people, by the time they have, and it is one of the top 3 cancers by incidence and by fatality, and it doesn't have to be. So by the time it's diagnosed because of symptoms, it's often too late, right? But before, if early on diagnosed through screening, through your annual checkup, fully curable. Fully curable. You never have to worry about it, right? The other thing is about, again, talking about prevention and stuff, and we'll talk about it in a video just about this in the future, is the smoking cessation. I have had patients that will come to me and they're smoking, and I tell them, you are doing everything else. You are maintaining your weight, you're exercising. How about starting thinking about quitting smoking? Be a better role model for your kids, keep healthy. And of course, there's always the examples, so and so smoke 2 packs a day, lived for 100 years. You don't know what your genes are. You could be predisposed to some sort of cancer, you don't know. And this smoke can be a carcinogen that turns it on, right? The oncogene that you are genetically predisposed, and then reactivates the cancer. You never know, right? So if you ever bought a lottery ticket, you believe that you could get that lucky to win the jackpot. Same thing goes with this. So why take a chance? So I used to tell patients, and I remember this 40-year-old that every time I used to bug him, and he said, you know what, I really enjoy smoking and I really love it, makes me feel good, don't worry, I'm fine. And every time I would bug him. But anyways, so one day he comes, and because he had a little bit of blood in the urine, so we did some tests, and unfortunately he had bladder tumor that had already metastasized. And he came, and by that time he was 48, 49, and he was in tears. And I said, well, this is bladder cancer, and the most common cause for it is smoking being the biggest factor. And he's like, okay. He took his pack and he threw it in the garbage. He said, I'm not going to smoke anymore. And I told him, I'm sorry, this is too late. The fact that there's no, unfortunately at this stage that he had, life expectancy was 3 to 6 months, and too late, And it's very unfortunate because it could have been prevented if he had not smoked, if he had come for his regular annual checkups and regular screening. The chances are it could have been discovered earlier, but he would come sporadically, and he would love his smoke too much, and that's unfortunate. Now, his story, in fact, the patient I saw right after him, after that difficult conversation, was a 30-year-old that smoked and said, doc, don't worry, my grandpa smoked, everybody smokes, it's not a big deal. I just told him the story. And he actually right there took his smoke and threw it away. And so it probably saved his life. Now, having said that, there is true that some people could smoke a pack or 2 a day and nothing happens to them. But why take a chance? It's just like closing your eyes, running across the highway. 100 people doing that, probably 90 of them would make it to the other side, make some accidents along the way and stuff, but 90 of them would be alive. But 10 of them will get run over by a truck or hit by a car and die, or something horrible happen to them. So the question is, would you close your eyes and run across highway? If your answer is no, then you're gonna smoke. Why take the chances? What's the point? Now, having said that, for people that are smoker and stuff, smoking addiction is difficult to quit, and there's many different ways to go about it. And of course, it's not as simple as just say stop smoking. But that's one of the future videos that we'll talk about it if you guys are interested. The other thing I like about the annual checkup with your family doctor, keeping in touch, is gives a chance to demystify some of the myth on the internet. Dr. Google versus MD. I had to work hard for my degree, and I'm proud of it. But everybody that posts on Google don't necessarily have a medical degree. YouTube, same thing. So that's the issue. I see stuff on the internet and I'm shocked. How is this allowed to be online? And for instance, vaccinations. There are some fake, bogus websites that even one of them claims to be a pediatric society of some sort, which is a fake website, that talks about horrible things about the vaccines, but it's all misinformation. As I said earlier, every medication, every treatment has potential risk and side effects and benefits that we should know about. And that same goes with vaccines, that there are some risk and potential side effects associated that we should know about it. But again, know about it from a qualified healthcare provider where it can give you a non-biased information. Sometimes people want to just sell some product online, some gimmick, some so-called natural health product or alternatives, etc. And they create this myth so that they can benefit financially. So again, it's important to not just believe everything you read online, and just click online for how to become taller. There is creams on sale, there's pills on sale for everything. How to become taller, how to have the breast enlarged or other body parts or etc. And none of these things work. They just make somebody else richer. But if you read the website, the amount of detail they put into it to make it look real, it's really mind-boggling that somebody would put that much out of their way. But then again, it's a multi-billion-dollar industry. And again, going back to the annual checkup, important thing is keeping track of blood pressure, cholesterol, blood sugars, liver function, kidney, renal function, and blood counts. And what I used to do, and I still do, when I do a checkup on family practice patients for annual checkup, I give them a copy. I say, keep a folder for yourself for two reasons. One is some doctors may retire, may move or something, and it's good for you to have your own kind of blood results in front of you. And it's also good for you to be educated about it, and you follow it yourself too. When you see that sugar, when it used to be 20 pounds heavier, was 8.2, and since you lose the weight, it has become 5.8, and you have maintained it. And when you gain a little bit more weight, it goes back to 6.9, and you lose it again. That just kind of, you become in control. As a patient, as a doctor, when I work with a patient, I say we're working as a team together. We're gonna set a goal together, and we're gonna reach it together. So you have to be a team player as part of the team. Learn about the vitamin levels and the daily requirements. Get your vitamins and nutrients in your diet if possible. Do not feel that everything you can get in pills. I go to the store, I see blueberry pills, raspberry pill, watermelon pills. Why? Why not have the watermelon? Why not have the actual blueberry? Number one, some of these pills been sitting in shelves forever. Most of these pills don't have a strong regulation, and they may not even have what they claim to have in it. As far as vitamin B12 goes, aim for levels of 220, but if there's chronic pain or fibromyalgia involved, levels higher than 500 is desired. Low B12 can cause fatigue, tiredness, lethargy, and depression. Low B12 can also cause neurological symptoms and numbness in hands, in feet, tingling. There's no upper limit, so you cannot overdose on it. Basically, vitamin B is a water-soluble vitamin. Any extra you peed out. The vitamins that are fat-soluble can be built up in the body and at a very high level can be toxic, and those are vitamin A, D, E, and K. If low B12, first try increasing the dietary intake. You can Google or go to Indigo and look at the books on this to see what are the foods, good sources of B12. Next, can consider taking supplements. The 1000 microgram or 1200 microgram, they're pretty cheap. 6 months worth of it is around $20 to $30 at Costco and other places. And People with low B12, sometimes the body loses the function to absorb it. So if you take high dose supplement, even though a small amount you absorb will be enough to bring your levels to appropriate levels. And some people may not be able to absorb at all, or may forget to take the pill, or might have had some surgery of a small intestine and not have the ability to absorb at all, and they would benefit from monthly injection. Of course, do not start any supplement before testing levels. Now, again, in some of the health stores, you may see B12 or B vitamins promoted for depression, anxiety, energy, and etc. Let me just be clear. If your B12 is normal and you take extra B12, doesn't give you more energy, doesn't get rid of tiredness or fatigue, doesn't get rid of depression or anxiety, so it's important to check your levels first. Only if your level is low, then that low level could be a contributing factor to depression, anxiety, lack of energy, numbness, tingling, pins and needle, and etc. Another vitamin to know about is vitamin D. Now, you gotta have at least 75. Having said that, years ago, OHIP used to pay for checking vitamin D level for everybody. And I checked it on all my patients. And I tell you what, 9 out of 10, probably more than 9 out of 10 patients were low in vitamin D. If you live in Canada, you're gonna be low in vitamin D. I was borderline on vitamin D, even though I drink skim milk like it's water. I probably drink 2 liters of milk a day, but still I was low. So just the dairy alone is not enough either. So if you live in Canada, you should take at least 1,000 units of vitamin D a day in summertime, and in wintertime, 2,000 units. And if you do not drink any kind of dairy or vitamin D, sources of vitamin D such as the fatty fish, etc., then you may need even higher amount. Now for people that have osteopenia or weak bones, OHIP still does cover vitamin D, and if you have private insurance, you can still have your vitamin D levels checked. And otherwise it's around $35 to check the level. It's good to maybe once in a while do it, but otherwise just talking to your doctor can recommend the appropriate supplementation. Now, vitamin D is made by UV light on the skin, so it's not recommended to have too much sun exposure with the UV light because of the skin damage. With the deterioration of our ozone layer, this becomes more and more important. So even some people advocate that even summertime should take higher doses of vitamin D if you follow the appropriate recommendations for sunscreen. And people that have osteoporosis or weakening bones, they may need significantly higher level of vitamin D, because vitamin D and vitamin D is needed to get the calcium into the bones to make the bones stronger. Low vitamin D is linked to diabetes, cancers, heart disease, and many other conditions. Every day they're finding more things that vitamin D is involved with. Now, iron. Iron. Men may have high levels and should avoid multivitamins with high iron, and some may have some condition called hemochromatosis. And the problem is when iron is too high, it can build up in the liver and can cause actually major issues. So it's important to know what your levels are again before taking any vitamins or supplements. Women often have low level and may need supplement mainly because of menstrual cycle. They lose iron with the period, and low iron can cause fatigue, tiredness, shortness of breath. And when you check levels, you gotta check levels both for ferritin and serum iron. So ferritin looks at iron stores. However, in elderly and patients with chronic conditions, ferritin can be high due to the chronic condition. And so erroneously, the doctor may say your iron level is good. But it's best to check ferritin and serum iron levels, and together that gives a better clue as to what your iron level is and how much you need. Low levels have to be investigated because they could be a sign of major illness. So there could be a sign of autoimmune disease, could be even a first sign of cancer of stomach, or sometimes bleeding ulcer in the stomach, which early on the only sign of it would be a low iron. So it's very important. Often when your doctor finds low iron, especially in men, would send for endoscopy. So they put a camera from up here to check the stomach and a colonoscopy from bottom to check in the colon. because sometimes that could be an early sign of cancers and other conditions, so it should be investigated. Some iron supplements cause more side effects than others, so some patients do not take iron pill because it constipates them or causes stomach side effect, etc. So it's important to talk to your doctor about which one is more appropriate, and there are some that are more gentle on the stomach, have more iron in them, and are more effective. And sometimes you may have to try 2-3 different ones to see which one works better for you, because again, everybody is different and everybody's response to medications can be different. Diet. This is a huge topic. So I guess you are what you eat, and we have to do an entire talk on diet, because it's not just what you eat, it's how you eat it, when you eat it, what proportion you eat it. It's not just calories, it's not just fat, carbohydrate, or protein, etc. So we'll do a whole session about diet, and it's so important, so misunderstood topic, but it's yet so important and linked to many of being overweight is linked to many diseases, including cancers. Exercise starts low and build it up. It's an important part of prevention. I mean, regular exercise, 150 minutes per week, 20-30 minutes most days per week, can reduce blood pressure, blood sugars. So I go as far as saying one blood pressure medication can be reduced or taken off, one diabetic medication can be reduced or taken off, and sometimes cholesterol medication can be reduced and taken off. So it's huge. So one of the questions is sometimes, and as earlier I was saying, that if a person goes and has a borderline blood pressure or has high blood pressure, they find in their physical, the doctor won't right away give medication, would give lifestyle modification, including exercise 20 to 30 minutes most days of the week. Sometimes that's all is needed to reduce the blood pressure. Huge difference, huge difference. And there's, of course, there's other factors too that we'll talk about when we get to that. You gotta find what works for you and stick to it. I tried jogging, running, walking. I enjoyed all of them, but I found my passion in bicycling. I bicycle every day, at least an hour or two. And on the weekends, I may go 50K, 60K, and it's a great thing I enjoy, either by myself or I go with my friends. And it's a good exercise. I try to go in the ravines, different scenery up. I don't go to the streets and stuff. I find different ravines that I can go to, that I can do safely bike riding. And we'll talk about different exercise in the future as well. But you gotta find what works for you. And also, when I park my car, I park the farthest parking spot available. I don't take the escalators or elevator. I always take the stairs. And basically, just try to be more active. We'll do again an entire talk on exercise soon. So again, when it comes to lifestyle, again, in the future we'll talk about all these different topics: diet, exercise, smoking, alcohol, coffee, pop and soda, juice, fruits, junk food, sweets, etc. These are many things that we'll talk about. And this video already became longer than I was expecting it to be, but I hope that you find it helpful. And this is just the starting video, and in the future we'll build upon this. And please, in your comments, let me know what topics you want to talk about, and we'll do that in the near future. This was the first video of the series, Your Body, Your Health. I'll see you soon.